I chose to do my presentation on bipolar disorder. Bipolar disorder is a mood disorder. It is a mental illness that causes unusual shifts in a person's mood, energy, activity levels, and concentration. There are three different types of bipolar disorder. There's bipolar 1 disorder, which most people who have this have manic episodes that last for at least 7 days, or by manic symptoms that are severe that the person needs immediate care. There's bipolar 2, which a pattern of depressive episodes and hypomanic episodes. These ones are less severe than the manic episodes, like in bipolar 1. The third type is cyclothymic, which is a recurring of hypomanic and depressive symptoms that are not as intense enough to qualify as hypomanic or depressive episodes found in bipolar 1 and bipolar 2. However, this can progress into bipolar 1 or bipolar 2 as well. That has been estimated that 4.4% of US adults have experienced bipolar disorder, range from 18 years old or older. There has been no evidence or statistically studies that between women and men, one or the other gets diagnosed with bipolar. It's pretty much the same. Out of, 5 to 6% of individuals who are diagnosed with bipolar do die by suicide. One third of them report a lifetime history of suicide attempts. And out of the bipolar 2 individuals have had a higher lethal attempts in this diagnosis than bipolar 1. There are three known risk factors. The first one is brain structure. There hasn't been enough evidence or research behind this to support this, but studies have shown that individuals with bipolar disorder, their brain is structured different than those who don't have any type of mental illness. There is biochemical. This shows low activity levels of norepinephrine. I can't say that word, but and serotonin, which have been a long contributing factor to developing depressive disorders. And since one of the symptoms for bipolar is depressive, they believe that a chemical imbalance plays a role. There is genetics, which people who have parents or siblings with bipolar disorder has an increased chance of being diagnosed themselves with bipolar disorder. There are quite a few treatments that people can use to help with symptoms for bipolar. One of the most prescribed medications are mood stabilizers or atypical antipsychotics. Lithium is one of the main mood stabilizers that it has been prescribed to people. It helps prevent mood episodes or reduce the severity of the episodes and reduce the risk of suicide. Lithium is still being researched on how it works because there are some patients or clients who find that lithium does not work for them. So scientists are still kind of looking into that part. Antidepressants are a good addition with mood stabilizers, but um, if people who have been misdiagnosed and given antidepressants can cause manic episodes to increase. There is treatments called psychotherapy, which is a talk therapy. This aims to help people identify and change troubling emotions, thoughts, and behaviors. Also help support, educate, and guide individuals who have bipolar disorder, and also educate, guide, and support their families as well. There is cognitive behavior therapy, which this is more insomnia focused, but those who have sleeping disorders with bipolar disorders, this can help them with that part. There is light therapy, which is one of the best treatments out there that helps with seasonal affective disorder. Those with bipolar disorder experience seasonal affective disorder more often in the winter. There is also electroconvulsive therapy, which this is a brain stimulation. This is only meant for those who have not seen illness improvement or is high risk of suicide. There's also repetitive transcranial magnetic stimulations. This is another brain stimulation that uses magnetic waves to relieve depression, but is not as powerful as the ECT. There are newer treatments for bipolar disorder, which is the interpersonal and social rhythm therapy and family focused therapy. Some of the things that I found interesting about bipolar disorder, one is I didn't know that there was three different types of bipolar, so that was pretty cool to find out. What I also thought was interesting is how much uh, comorbidity to bipolar disorder. Bipolar 1 has anxiety disorders, alcohol use, and other substances use disorders, ADHD, and all of that. And bipolar 2 has pretty much the similar things, but anxiety disorder is being the most common one. For psychothymic disorder, you will find substance related disorders or sleep disorders as part of that. Some other interesting things that I found currently, as like I said earlier, lithium is one of the main treatments for bipolar disorders. Um, there have been studies, more genetic studies about this, and that can help or come closer to finding out how lithium actually works for those who found that lithium has been successful. Studies led by Harvard Medical School and the Broad Institute of MIT and Harvard have revealed a new gene, which is the first gene so far, which is called AKAP11, and they have found that this may be the strong risk factor for bipolar disorders. Their further research on this is hoping for them to be able to pave the way to better understanding the causes of the condition and find potential new therapies for those who are diagnosed with bipolar disorder. That is it. Here are my references that I pulled my information from, and I hope everyone has a great rest of the week and look forward to looking at your guys' presentations.